It's the Metro on WDET. I'm Robyn Vincent. For years, many of us have avoided therapy. We bought into the stigma. But things are changing. These days, people are seeking therapy more, even over medication. And that shift is generational. Younger people, Gen Z especially, have made therapy ordinary in a way their parents and grandparents never did. But how do you pay for it? Therapists around the country are complaining about private equity expanding into healthcare services and then making it harder for therapists to provide care to their patients. Earlier this month, a local health insurance company may have made things even harder. If you see a counselor in private practice through Blue Cross, your therapist could be dropped from your plan in March. So what does this mean for our access to mental health care? What does it say about our priorities? To discuss, I have David Sniderman here. He's a local counselor and art therapist with the Willow's Edge Counseling and Healing Arts Center. David, welcome to the Metro.
Thank you for having me.
So I also want to note before we get started, the Metro contacted Blue Cross Blue Shield. We asked why they decided to eliminate people's insurance coverage for limited licensed therapists who practice in private offices. In an emailed statement, they said, Blue Cross has a responsibility to ensure our customers' dollars pay only for high-quality care delivered by or under the direct supervision of fully licensed clinicians in accredited facilities. Okay, David, that statement is confusing.
Yes.
What kind of clinicians are we talking about here?
So right now, limited license clinicians who are graduated from master's programs and are beginning their career are able to bill under a fully licensed therapist. And that's the way it's been for the last, I think, 20, 30 years at least, and probably more. This has always been the way that I've known it. This is the way that all of the private practices have built their business models on. And what's going to happen now is that Blue Cross Blue Shield is saying that the limited licensed counselors are no longer able to bill under the fully licensed counselor, or the Incident 2 billing, it's called. And this is going to affect we have 10,000 limited licensed counselors in Michigan right now. Social workers, mental health counselors, psychologists, and marriage and family counselors.
10,000, over 10,000.
Over 10,000.
And so we're talking about potentially thousands and thousands of people who will be affected by this. Now, someone might say, why does it matter that clients continue to see the same therapist?
The fact is that rapport is the most important factor in a client's progress. The rapport that they build with a therapist is something that is developed over not just days or weeks, it's months and sometimes years in order to get to a place where a client can continually make progress and feel comfortable, safe, and feel that they're not being judged.
Yeah, I can relate with this. I think about some of those first sessions when I saw a counselor, and I wasn't quite ready to open up, and I needed to feel like I had some kind of mutual understanding and mutual trust with that person. I needed to feel like they were really starting to get to know me. And I needed to also know, and I know you are all so non-judgmental, but I still needed to really feel that like on a cellular level.
Yeah, that takes time. It's not something that just happens. And, some people spend years trying to find the right therapist. And when they finally do, it could be someone who just finished grad school. And someone who finished grad school is not someone who's untrained. They've gone through practicum, which is where they see actual clients under supervision. And then they go through an internship, which they have to do 1,000 hours of seeing clients and doing paperwork and knowing how billing works and understanding the ins and outs of private practice or community mental health or working in a facility. All of these things bring us to being a limited license counselor that is a very qualified counselor. They just haven't gotten their full license yet.
Okay, and I would imagine that as with many evolving arenas of science and medicine, that some of these newer counselors also are bringing things to the table because they have just completed their studies that perhaps someone who went to school a decade or more ago are not.
Well, one of the greatest things that I find from our limited license counselors and even our interns at our practice is that they do come in with new perspectives. They come in with new ideas, and they come in with new research that we might not have gotten in the general public yet because it's only available to universities through PubMed and stuff like that and publications. And so they come in and they have these wonderful ideas, new perspectives, new ways of looking at things, and they actually help educate some of the fully licensed counselors who have been in this field for, like you said, decades or years.
Okay, so the top line here, again, is that thousands of Michiganders could lose access to their mental health providers due to this decision. What's going to happen to those clients? I mean, how many of them do you think are going to quickly find new therapists?
I don't think it's going to be quickly at all. I think this is going to create a real barrier to care for not just Blue Cross clients, but for all clients seeking care, because it's going to mean that, like we said, there's over 10,000 limited license counselors. So all of those counselors who are seeing Blue Cross Blue Shield are going to have to either get rid of their clients, or their clients are have to go to a different counselor, which is going to create longer wait times, which is already a crisis in the field. Is that I know at our practice, on average, it's a 4 to 8 week wait period. And many practices are longer. And so this is going to create even longer wait times. It's going to create more barriers to care. It's going to be harder to find a counselor. And it's going to create a mental health crisis that I don't think we've seen since the 80s.
You think it is going to have profound enough impacts to create a crisis in terms of the number of people who are going to have trouble accessing mental health care?
I do. I think it's going to be a compounding problem. I think it's not just going to be that the Blue Cross Blue Shield clients are going to have to go on wait lists, but then that's going to create all the people who come after them to also be on those wait lists. And so we're going to see that those thousands of clients, at our clinic, we have, I think it was, I have the numbers right here, 40% of our clients see limited license counselors.
Wow.
Yeah.
Almost half. Okay.
Yeah.
I want to humanize this a little bit more and think about the folks who are in that chair talking to some of these therapists, because there's a real generational split. Mm-hmm. Younger people are now the most likely to be in therapy and the least likely to see any stigma in it. And at the same time, baby boomers remain the least likely to go. A lot of younger patients see exactly these lower cost, often virtual, limited license counselors. Mm-hmm. So does a cut like this land hardest on younger patients?
I think the cut on this is going to hit all patients. I think younger patients are going to be one of the largest populations that are going to be underserved. Right now, they're probably one of the most underinsured. Mm-hmm. And the ones that are insured are more than likely going to be insured by Blue Cross Blue Shield.
And when you think about access, I mean, again, as I mentioned, this can often be a lower cost option, right? Mm-hmm. And so we're talking about eliminating access for people who are of a lower income as mm-hmm. well. Is that right?
Yes. It's going to create barriers to care for people in lower incomes, and especially in rural areas. Right now in rural areas, they have the hardest access to mental health care, sometimes having to drive 50 miles or more to the closest clinician. We serve rural areas in both Oakland, Macomb, and Lapeer counties, and we're seeing that people are driving half hour, 45 minutes just to come see us. And so it's going to create barriers for lower income and rural communities. And there are communities that are and people that are already underserved in mental health field.
It's the Metro on WDET. I'm Robyn Vincent. My guest is David Sniderman. He's a therapist in Metro Detroit. We're discussing Blue Cross Blue Shield's recent decision to limit its mental health coverage and the consequences for both patients and therapists. Now, I want to think a little bit more about Blue Cross's perspective. It says no one will be left without care, that it has thousands of licensed therapists, and it can connect any patient to any of those therapists within 2 days. What do you make of that perspective?
I do not believe that at all. And I think that what they might be talking about is pushing them towards online counseling, that, it's a field where they can pay the counselors less. They, pay them an unfair rate. They often are not in the state. They might be licensed in Michigan, but they won't be here, so they don't know the problems and the intricacies of living here in Michigan, especially in the metro area. Working for the big three, stuff like that. That's stuff that is very, specific to this area.
Can we stay on that point for a minute? Because I think that's really interesting, and some folks might not immediately think about that. The importance of sharing geography with your therapist. I mean, talk a little bit more about that.
I think it's a very important thing is that, when people come to me and they talk about, we have clients who work for the big three or associated with the big three, and working there is something that is very hard and difficult on people, just because it is the lifeblood of the Detroit metro area, and it is something that we are very proud of here. And I don't think outside of this region that people really understand that and grasp how important the big three are to our identity, to our workforce, and to the anxiety that it can cause sometimes when layoffs come, because nobody has any idea who's getting laid off or when they're getting laid off. And these are normal things that happen in our cycle here in the Detroit metro area, is that we just expect that to happen, is that, GM's going to lay off people, Ford's going to lay off people. And it's just part of, business and the regular happening. And I don't think people outside of this area understand that cycle and how this area is connected with especially the big three.
Now, what about therapists? I mean, we have talked a little bit about the clients and what this will mean for them. What are the consequences for you and your colleagues?
I think that we are going to see a decrease in clients because it's going to be harder to access care at private practices. I think that we are going to have to, it's going to take longer for limited license counselors to get their full license. It'll probably also take longer for interns to finish school, which means they're going to accrue more debt because it'll take longer for them to finish their internships because there's going to be less clients for them too. It means that places are going to have to lay off limited license counselors or stop hiring limited license counselors. And so they are going to have to be forced to go to some of these online places that are going to not pay them a fair wage or a fair rate. Or even a living wage. And we're going to see that because of that, it's going to be harder to access care. People are going to stop, trying to access care, or they're just going to, not want it because, when we tell them that it's going to be 10 to 15 weeks before you can see a counselor, that seems like forever to somebody who might be in crisis or just out of crisis.
A few months ago, we had Linda Michaels on the show. She's a psychologist in private practice in Chicago and a co-founder of the Psychotherapy Action Network. And she was speaking about the administrative burden that health insurance companies now place on therapists and how therapists are being underpaid. Let's listen.
When I first went into practice, I signed up to be an in-network therapist with Blue Cross of Illinois, which I still am to this day. And it probably took around 5 or 6 months for my application to go through. I had to follow up multiple times. I know that on the medical side, like your regular PCP, they can sign up with insurance in about 2 weeks. So, the differences are drastic. And I think, between being underpaid and overburdened with all of these policies on the admin side, therapists look at this picture and say, I just can't make this work.
Underpaid and overburdened. David, do you know of therapists who have stopped practicing because of these very things, of feeling underpaid, overburdened by health insurance companies?
I don't know any that have stopped practicing, but I do know I have friends that that have stopped taking insurance and have gone to only out-of-pocket pay because of the difficulty it is to deal with insurance. And I know that there are a lot of people who are looking into that model because some insurances don't pay a fair wage. Many of them are very difficult to sign up for and get boarded with. Luckily, Blue Cross Blue Shield is not one of them. It's actually one of the better ones, and this is why it surprises us that they're changing this policy.
When did it become one of the better ones?
Ever since I've been in the field, they've always paid on time. There's very little arguments. If there's any, rejection of care, they give you a good reason, and you're able to fix it right away. They get back to you right away, and this is why it's surprising to me because they always seem to be one of the people who is very much in line with mental health care. And, that's why I really wish they would come to the table and talk with the counselors about this because there are solutions to be made, not just an argument to be had.
So then why ultimately do you think Blue Cross decided to do this?
I think that it's probably multi reasons, but I think the biggest reason would be profit. Mental health care is one of their biggest expenses because it is something that people do every week. Whereas other expenses in insurance is usually once a year, twice a year, and then if you get really sick, then that's just something that happens. But this is one of their biggest expenses, and so we're seeing a lot of insurance company making changes to their policies about how often you can access mental health care, about who can provide mental health care.
Give me an example of some of the changes in those policies, because I think about mental health care and the fact that it needs to be quite frequent if you're dealing with something immediate, or even if you have bigger goals. It's like maybe I want to be seeing a counselor once a week, once every couple weeks, or at the very bare minimum, once a month.
Right. Well, one of the other insurance companies, Meridian, just recently changed their rules saying that clients can only see mental health counselors 26 times a year. So that's every other week. Many clients prefer to come on a weekly basis. I have some clients that come, probably 1.5 times a week on average because of crises, because of their trauma, because of anxiety, depression, a multitude of reasons. And it's hard to deal with, and it's not always something that fits into a box saying that you can only come on this many times.
Right.
Our mental health, our crises don't happen on somebody else's watch.
Yeah, I want to think about that. I mean, as opposed to, let's say, a medical doctor that you're going to see for a broken leg. Therapy, as we've been discussing, takes time, sometimes years. So how do you think we should be paying for mental health care in this country?
That's a
big sigh.
That's a big and hard question. I think that, ultimately, the big thing would be that it would be covered by, universal health care. And that this would be something that everyone can access without having to worry about how it's going to get paid for, how it's going to get covered, or how many times that they can come in a year or in a month, or I think ultimately what we want to see is that the insurance company, since that is our only resource right now, that they come to the table and they discuss these things with their clients, with their therapists that work through them, and have discussions so that they can find things that will be best for not just them, but for the community at large, for their clients, and for the people that depend on them for getting paid, like the counselors, therapists, and social workers.
I mean, yeah, we're painting a picture here that's hard to imagine. I want to end where we started, because I think it's an important point, and it's that you say what matters most in therapy isn't the method, it's the relationship between therapist and client. So make the case in the last 30 seconds. Why does that bond matter so much that all of us should help pay for it?
Well, as we know, mental health is something that is very personal. People have gone through traumatic events. They've gone through abuse, neglect. They have anxiety. They have depression, OCD, schizophrenia, all these things that are unimaginable to most people who are just living their lives. These are things that are hard to discuss. They're not easy to talk about. And in order to actually process them, get through these things, you have to feel safe. You have to feel like you trust the person sitting across from you. You have to feel that they're not going to judge you, that they're not going to push their agenda or have some kind of secondary or tertiary reason that you're coming to them. And so when you feel safe, when you feel non-judged, you're able to open up and you're able to process and get through these things. And you're able to have a good connection with your therapist, which makes your improvement and your process much easier.
David Sniderman, he's a local counselor and art therapist with the Willow's Edge Counseling and Healing Arts Center. David, thank you so much for joining me today.
Thank you.
It's the Metro on WDET. Coming up, he's been called the Joe Rogan of the left. And now he's endorsed one of the people who's running to be Michigan's next senator. Russ McNamara's conversation with political commentator Hassan Piker is coming up next. Stay with us.